Questions interviewing a marketer. Okay, when I am interviewing a new marketer for my home health agencies, or if I am questioning or providing services for other home health agencies to screen their marketers, I pretty much ask these following questions and assess from there how good their answers are and if they will be someone that's actually going to be right for my position. And I already know what I'm looking for. What we also do is if we actually work with another home health agency to find the right person for their agency, we also like to talk with the owners, the administrators, and the management team to see what personality they have as well, and try to figure out what is a good type of personality of a person that they should have in order to work with that particular group of people. So let me go ahead and start things off. The first thing that I do actually is this. When a person is in front of me and we're doing an interview, I'm going to test their phone skills. Because as a marketer, their phone skills needs to be on point, and they better be not scared to speak to whoever is in front of them. So first thing I do is I always test their phone skills. So what I do is I open up the white pages, or I just go to Google and find out whoever I want. It doesn't matter if it's a doctor, I'll go ahead and open that up. If it's a physician, I'll even have them call funeral homes. It does not matter. I will literally say, okay, call this number, and when you get the person on the phone, I want you to keep them in the phone for 5 minutes. And within those 5 minutes of conversation, I want you to be able to get, number one, a recommendation to a good movie to take out your girlfriend or your boyfriend, and a recommendation for a good restaurant. Now, you are looking at me right now in this video and telling me, why would you do that, Michael? Well, the question is this. If you are a good salesperson, if you are a good marketer, it doesn't matter what the product is that you're trying to sell. You just have no shame to be able to use the phone. Look, how many people out there do you know is scared to use the phone? A lot. Because if everybody was not scared to use the phone, then you'll be picking up that phone, calling nonstop to get more referrals. Let me ask you a question. You as an owner, you as an administrator, as a director of nursing, how many times have you called today for referrals? How many times have you called a doctor, an office? You know, if you're marketing out there, if you have a full-time potential marketer or a marketing team, and it's your phone day, you better be calling somewhere around 100 leads every day. Within that 8 hours, you should be able to call 100 leads. 100 leads just to get names, just to get the right people, just to be able to assess and plan. How are you going to market out there in the field? You know, I require that there will be one full phone day for each marketer every 2 weeks. And what you're doing there is you're gathering information. It's easier to gather information before you go out there and market. Wouldn't it be amazing if when you walk into a facility, you already know who the person you need to speak to? That is ultimately one of the biggest things. So the first thing I do, always put them in a test. I test them. Your questions that you're asking people when you're interviewing them the first time will let you automatically know if you're willing to keep them in your company. So put them, test them. Why wait to hire them and then test them later on and find out that they're duds? Right there alone, if they don't have good phone skills, if they don't have good communication skills, get rid of them. You need to be able to make sure you know what you're doing in the phone in order to keep on going. Okay, now that you have them in front of you, the next question you're going to ask them is this. Look, why did you want to apply for this position? You want to be able to find out, do they know something about your company already? What do you know about home health? What do you know about home care? If somebody is interested with a position, before they go for an interview, they will actually be able to research already and know what they need to do. If they don't even have a clue about home health, if they don't even have a clue about home care, or they do one of those classic sales move where well, why don't you tell me about home care, where they answer a question with a question. You know, those are what we call, almost a marketer, because that's how we do. We want to be able to ask questions, and it's okay to be able to hear that from someone. But you tell them, like, great, I'm glad that you want me to tell you about home care or home health, but I want you to tell me about it. If they are not able to actually answer to you and know anything about home health or home care, then ultimately what you want to do is you want at that point to let them know, look, when people work for us, we want to make sure that they're ready, and they always make sure they research and be able to know what the product that they're servicing. Because it goes the same exact way. When you're hiring someone automatically, you want them to make sure that they are able to research about your organization. Because what they do, if they actually research your organization, in the future when they are going out there in the field, they will know that research is very important. Pre-planning is always important. So if they did not pre-plan with you in the beginning, do you think that they're going to be doing the same exact thing when they're going out there in marketing? In marketing, in sales, we are literally applying for a job 24/7. We as marketers, as salespeople, we are applying for a job where we want to take care of your patients. So if in the beginning of them applying for a job with your organization, and they can't even do it the right way, do you think that they are going to be doing it the same way everywhere? Of course they will. So you want to be able to use that as a red flag. But that doesn't mean your conversation and your interview should end right there. You want to be able to ask more questions. One of the next question to do is this. Ask them the question, do you like winning? Are you a winner? Most of the time people wanting a job will say, yes, I like to win. I'm a winner. This is who I am. You then ask them this. Now, let me ask you this question. If you're a person who likes to win, who likes to make sure you become successful, is it okay for you that you become successful when other people out there will be losing accounts and will be losing their jobs? This is a test question to see how they're going to be able to answer. Now look, if they say this, yes, I am willing to do that. I am willing to accept that somebody's going to lose their job. This is one of the good people that you want to hire. Because look, if we feel bad for others, we're not going to try to go out there and get their accounts. Because in this industry, if a doctor is the right physician who does have patients that they refer to home health agencies, then yes, they are referring those to other home health agencies. So yes, you are going to have to be there to take an account from another agency. And you cannot feel bad about that. You need to be able to feel good because your organization is going to provide better care. Because why? Your agency is going to make sure that they do provide better care, that they have better services. But yes, it is at the risk of the fact that another person is going to lose their job. So you want a person who doesn't feel bad. Well, they will feel bad. They may show remorse, but they say it's okay because they know it's a competition. These are the type of people you want in your organization. You also want to ask them, when was another time in your life where you were able to win? And how did you obtain that outcome? How did you obtain it? So, when was the time that you won? And what did you do to make sure that you won it? The answers that comes out from these things will depend on what the person is and what he actually recollects. Look, he's going to be able to talk about, does he work well with others? He's going to say, hey, we worked as a team to create this, or we worked as as a one-person thing. I did all this. This is what I did. By you knowing this, you can kind of steer your next question to that person. If they say they worked with a team and they really was appreciative that the team helped out, then that's where ultimately you want to be able to have that person. But if they say that they work well by themselves, you also want somebody that can work well by themselves and win. Because yes, look, when they are there, when they are marketing for you, they are by themselves. So they need to be able to learn how to do things by themselves, but also you want to learn the fact that they can work with a team. Because look, the marketer by itself cannot finish the deal. He needs to have people in the back end who's going to support him. Because if he opens up an account, yet your nursing team, your administration cannot support him by providing the care that he says you will, then ultimately you will lose that sale. You will lose that referral. So you want to make sure that a person can be a team player and also the person can work by himself and also succeed. So if he says that he's good at working with a team, great. Tell me a time when you are able to do things by yourself, that you are able to win by yourself? Or do you feel that you need a group of people in order to win? Or can you go out there by yourself and be able to make sure that you win at things? When you ask that question, when you segue to that type of questioning, he will then go ahead and tell you what he feels about it. Because remember, you want a person who's going to be able to work by themselves. Now, if they say, I'm good, I won this, I did this by myself, I did this, I did this, I did that, you can then ask him, has there been a time where you were able to work well with a team? And what you're doing is you want to see if they can do both things, because they need to be able to be an individual, yet also work as a group. You also want to give him scenarios. Give him scenarios like that will actually happen with him. So tell me, what happens if a doctor tells you, I don't have time? Or you can tell him tell me at a time if a patient or a family member says that we can't afford the services. By you asking these scenarios, you're bringing up objections that they may face in the field. Remember, one thing that we also offer in our full training programs is we actually offer our objection, our closing the sale, closing the referral section and training, because we want to be able to give you guys all the objections that you're going to face out there in the field, because there's going to be a lot of objections. At Home Health Success Academy, we make sure that we handle and we provide you guys with everything that you guys will be able to face. So you want to give them a scenario of what type of objections he may face. In selling, in marketing, it doesn't matter what happens. It doesn't matter. An objection is an objection. And if you are able to recognize objections, you can go ahead and learn how to break past those objections. So go ahead. This is a sample of us practice drilling and rehearsing. When I hire somebody, I will go ahead and drill them. I will go ahead and give them scenarios. Because if they can start role playing, if they can start giving me great answers, I can see how I can build that person to be even better. If a person starts stuttering and is not able to answer, you give him some time to be able to relax and be able to give him the opportunity to always have time to think what they need to do. Look, they may be nervous, but ultimately, nervous is being fine, but you need to break past that being nervous and really give an answer, because that's what's going to happen. You're going to be in front of a social worker. You're going to be in front of a doctor, in front of a discharge planner. And when they give you that objection, when they give you, that lull, you want to be able to make sure you have an answer for them and break past those and get the close and get those referrals. Now, let's say, for example, that they actually have been in the home health industry, or let's say they have not been in the home health industry. What you want to be able to do is you ask them, well, tell me about, a previous company you worked for, or tell me that was different, and how is it similar to the products that we're offering? You want to see how he is able to sell. See, what he's going to do is he's going to start describing what his other companies have done. And by you asking him that question, you're going to start seeing if he is a good presenter. The next thing I want you to do is test his presenting skills. I want you to sometimes, and what I've done actually is this. I've actually grabbed a prop from my desk. Let's say, for example, I have a pen in front of me. I will show him a pen and I will tell him, here's a pen. I want you to sell me this pen. Okay? And by doing that, you're testing his presenting skills. Now, he doesn't have to be the best presenter. Now, if he's really good, oh my God, you better work with this guy, all right, and develop his skills more. But if he's not as good, you can still build with him. But if he tells you, here's a pen, it's a great pen, and they don't really know how to present clearly and to be able to deliver something well, then you're going to have to be able to work with that if you're willing to. Now, I've said in the past, you don't have to hire an experienced marketer out there. You don't have to hire an experienced home health marketer. But the thing, though, is you need to be able to hire somebody who's willing to learn, who actually has some skills that you can improve on, and you can customize them towards what you're trying to sell, what you're trying to provide services with. Now, if somebody's a dud, they're a dud. Nothing's going to happen to them. They just haven't realized that they cannot do what you're doing. Look, Also, some of the marketers out there that are applying for positions are nurses. Now, look, nurses are great marketers. They know the products. We need to make sure that they know how to present. And in addition to that is you're going to be spending a lot of money if you end up hiring a nurse to be your marketer. They need to be able to produce correctly. So it doesn't matter if they're not experienced in the home health industry, and you will still be able to find good marketers out there. And if they are experienced in the home health industry, I want you to take warning that if they were currently having a job, if they were currently working when they interviewed with you, then I would entertain it even more. But if a marketer is not working and they go into your facility asking for a job, I would kind of look more into further this person and kind of make sure I ask the right questions, because a marketer in the home health industry who is not working pretty much means to me that they don't know what they're doing. And I would literally stay clear from those type of people. Now, you also want to do negative and positive. What makes you a confident person and what doesn't make you a confident person. You want to know the full spectrum of the person, not just who they are or who they can be, but what causes them or what prevents them from being that person. Also ask them, what are you going to expect from them? What are you going to expect from them as an employee? Let's say you ask them, if I give you a job right now, what are you going to be doing? If they tell you, I'm going to be a loyal person, I'm going to be an amazing employee, I'm going to be a go-getter, what you need to ask them is this: don't tell me, show me. So the way I would say is, what do you mean by you're going to be a go-getter? What do you mean you're going to be loyal? Explain to me a scenario where you are going to be loyal, where you are going to be a go-getter, where you are going to be an exceptional employee, because that's what I want to hear. I want you guys to start understanding the one thing that you need to do is you need to see production and not a promise of production. So the best way to really ultimately gauge and look at as an employee, whether they're a nurse, whether they're a home health aide, a therapist, but especially for your marketing or your clinical team, you need them to tell you more than that, meaning show you that they can do it and not just tell you. So show me, don't tell me. This is what you need to be able to create. This is what you need to be able to show and tell your employees to do for you.